care, we have been able to blend this culture with modernity so that we can come to a middle ground where you don't tell them to break the culture, but then we can understand them. How do we overcome these challenges that the people face while still respecting their right to culture? When they get to a point where they realize that the culture itself is unhealthy, I think gradually you move them to appreciate that it is harmful a practice to do things that way, and in that case they will gradually move away from it. So that is what we are doing.
Well, that is it from the maternal and child. Look, I want us to also look how prepared is the Regional Health Directorate in terms of the outbreak of cerebrospinal meningitis. I know that we are entering into a season, and very soon probably we'll be getting some of these cases. How prepared are you so that we will not face those challenges that we faced last year or the time you took over, when it was CSM and then COVID? How prepared are you?
Yes, so we agree that Upper West region it has perennial challenge with meningitis. Every year there will be an outbreak. It depends on how it is managed. So the key to really preventing death and also preventing spread is what? Early detection. So building capacity of our staff to early detect the cases when they come is key. And this is the season. So what we usually do is to send signal to the various districts and health facilities to prepare, do ABCD. We analyze their resource availability, technical capacity. As a region that has frequent movement of people out of the region, we have to always train. And there are plans to build capacity, do the training of clinicians and disease surveillance officers to be able to early detect these cases, to be able to take appropriate samples. And as a region, we used to send our samples to Accra and Tamale. When you suspect a case and you pick a sample, you send it to Tamale where they will do the test. It takes a long time for the results to come. But we've been able to get that machine, they call it PCR machine, installed at the regional hospital that can do the screening, the testing for meningitis, so that when we suspect cases, you can actually do the test here and then you can detect it early. One of the challenges that were faced during that period was that they sent the samples to Tamale Public Health Reference Laboratory. It was not until after about a month that results came that you are dealing with this particular outbreak. By that time, it had already spread. So it was not like firefighting. With the capacity to do the testing here, clinicians' capacity built to manage cases and to identify them early, we are in a position to be able to early detect and contain outbreaks when they occur. But we have to do this in collaboration with the people, because the people will suffer the consequences. You don't even want to fall sick. Others, if you survive, sometimes it has effects on the brain. So what we always do is to start mass education during this period. The weather is hot. People should sleep in the open, or if you have to sleep in your room because of security, you need to open the windows, blow the fan, so that the germ is not transmitted from one person to another. It's a germ that is staying with us. Normal. I can have it, but I don't fall sick. When I transmit it to you, you can fall sick. So when we say avoid overcrowding, open windows, sleep in the open, and then when you are coughing, cover your mouth and nostrils when you are sneezing.